What has this world become? Where is the humanity? The human race has found yet another way to cross the line of ethics. Couples around the globe are requesting prenatal genetic screening without even thinking about the ethics or hazards. They just want to ensure that their child is disorder-free. But what happens to those poor, defenseless fetuses that do have a disorder, you ask? Well, I'll tell you what happens. They get executed, killed for being different. Oh, the horror! They say that prenatal genetic screening is beneficial because 3% of babies born have a major defect, and that 50% of those defects are Down syndrome. I say that 3% of babies is just adding to our genetic diversity. The more the merrier. Some genetic disorders, such as sickle cell anemia and hemophilia, have some survival advantages. But at the rate we're going at, if the world was to be hit with a serious case of malaria many years from now, the human race would not do so well, because all those lucky fetuses with sickle cell anemia were aborted. I can almost understand where people are coming from if they have a specific genetic disorder in their family lineage and wish to abort a fetus with that disorder to avoid future generations from being affected. But who are they to discriminate? Imagine how isolated those people with those disorders must feel when they hear that people terminate their pregnancy to avoid having a child like them. The risk of birth defects increases with the age of the mother. Once she hits 45 years old, the risk is 1 in 21. Prenatal screening allows families to prepare for a whole lot of work. There are many different methods of gene checking, including amniocentesis and chorionic villus sampling. Amniocentesis is a test that takes a look at the floating cells around the fetus by stabbing the mother with a needle through her abdominal wall. And if she's up to it, she can get stabbed an extra time to be numbed during this process, free of charge. Amniocentesis has a 1 in 200 chance of losing the pregnancy. Chorionic villus sampling has a 3% higher chance of miscarriage than amniocentesis. And if you're lucky and the tests aren't clear enough, or enough cells don't grow in the lab, or even if there wasn't enough cells collected in the first place, you can do the test a second time. Not so great for the baby. I think that these screenings should not be available for mental or physical characteristics, and only for serious disorders. Not everyone is fit to live a lifestyle where they can take care of a kid with special needs. If you're stuck with a kid with special needs, you'll be paying out of your buttocks because they are quite expensive. And what sucks even more is that the more expensive they are, due to the severity of the condition, the less you can work because they need all of your attention. And 71% of the time, it's the mother's job that gets affected. So if you can't work and you got a lot of expenses to pay, you're in a pretty bad situation. But people want to use today's technology for all the wrong reasons. A survey was done in Finland, and 1 in every 10 people said that they would choose to terminate their pregnancy if they found out that the fetus was homosexual. Now that's just cruel. So, you selfish people out there, next time you think about getting a prenatal genetic screening, think about everyone else you're hurting. And remember, genetic screening is the worst of intervening. If you want the perfect baby, don't go all crazy by having an abortion because it ain't always a good option. T-Bizzle out.
1, 2, 3,
Drop it.